Hello, my name is Yoshi Bauer. Welcome to the My Special Needs Connection webinar and podcast series. As a parent of children with special needs and as a professional advocate, I understand the challenge of connecting parents and professionals with the information that they need to serve children and adults with special needs. At My Special Needs Connection, we empower parents and professionals through valuable instruction and insights of experts in the special needs community. We're excited to come alongside you to provide you with information that you need. Let's grow through the exchange of knowledge and the hope of success. Be sure to subscribe to our newsletter and YouTube channel for new releases. Please enjoy our webinars and podcasts.
Well, I want to welcome you here today. We're very fortunate to have with us Dr. Renzi Heidesing. He is the founder of Brain Learning. He is a licensed educational psychologist. He does testing and evaluations of children with disabilities. He is a professor. He's a board member of the Autism Society, Epilepsy Foundation. He's done thousands of IEPs in the community, and he's been very involved during this COVID period. He's been able to do evaluations in spite of distance learning, and he has a lot of helpful information to share with us today. The topic is helping children during the COVID-19 pandemic, special education testing. So we're going to learn a lot about the do's and the don'ts and what the rules are and how evaluations can be done. They're so important to your child's special education program. So we're going to be learning about that from Dr. Heidesing. So let's jump right in. Dr. Heidesing, before we get started and kind of the topics, would you tell us a little bit about yourself?
Yes, thank you, Thomas. My name is Renzi Heidesing, and I am an educational psychologist. I've been working for children and with children for 25 years. So I've spent most all of my adult life working in some capacity with children and adolescents. And I've had fortunate experiences of previously sitting on the school board for the Autism Society board and a number of boards in the county. I've been a school psychologist for 12 years, worked in the schools, and a mentor for the universities here in San Diego, Chapman University, San Diego State, National University in Alliant, helping graduate students. I currently teach a neuropsychology class at San Diego State in their School of Education. And I'm just extremely passionate about children. I've spent my whole adult life thinking and acting and learning about children. And about 6-7 years ago, I left the public schools and opened up my own practice. And today we serve kids all over the state of California, providing assessments of kids with known or suspected disabilities.
Wonderful, great. Well, we're going to focus our discussion today about distance learning and assessments. And obviously, you and your company have had to pivot, just like many people, during COVID with distance learning. And you guys have been able to do some amazing things and some successful things with distance learning and assessments, and we'd love to hear more about that. So with that, let's go ahead and get started. So the first question I have for you is, what generally has happened since March 13 when schools closed? What's happened with special education?
Thank you. I think one way to put it is the educational framework that we all became accustomed to and we relied on and made predictions about changed. And it wasn't the first time that some kids had been homeschooled and done virtual schooling, but that's not the majority of kids, and certainly not the majority of special education models. So the delivery model had changed since COVID. Now, almost a year later, I'm looking back and what I've observed, and like any human creature, we adjust. And I've seen a lot of adjustments in the meetings I've been in, and the children that I've interviewed and been a part of. But it's definitely not the same. When COVID it happened on March 13th, and we were told to stay home in California, the special ed laws were written and still had to be followed. And so, and to this day, still, special education has to be provided. So the government never said, stop, you don't have to do and work with and help kids with disabilities. So that's important. And what does that mean? Well, from district to district, that can be very different in my experience. And I think that's where, this whole talk here and just some knowledge for you as parents to understand what your rights are, what your role is, and what the expectation should be. This is not a time to back off and give everybody a pass on kids with disabilities. It's quite the opposite, but we have to be realistic and have to come with knowledge. For example, in the state of California, the California Ed Code defines like the services that kids with dyslexia need as evidence-based, multi-sensory, direct, explicit, structured, and sequential teaching. And that's just, quite frankly, difficult to do on Zoom, as we know. And the kids that need it the most are the first graders, the kindergartners, the second graders. And it's not easy to deliver that research-based methodology on Zoom. Now, it's not impossible to help a kid this way, but it's just the barriers are increasing. Another perspective in the research around social media and screen time, the happiest a teenager will ever be when asked is physically in front of another teen. So think about that sort of perspective there. If you're a high school kid, which most high school kids in San Diego and California are sitting at home doing remote learning, you've taken away the most motivating factor of going to learn every day is being around kids. That's all taken away. So that's a barrier to accessing learning, and that's with and without disabilities. Now, some kids have done better. Kids, I think, that have social anxieties, social disabilities, executive function difficulties, trouble keeping up with the changes and the time demands of typical school. There's been maybe some relief and some options to pivot a little bit in the home and manage things differently. And so some kids have done better. But the last thing I'll say is in December, the US Census Bureau put out a study that 42% of people surveyed in the United States had symptoms of anxiety and depression. And a year ago before, in 2019, it was 11%. So that's a huge jump. And nobody's surprised by it, I'm sure. It's not like wow, I wonder why that's happening. But those are parts of what's happened since special education has to go and change in such a big way.
Sure. And specifically, let's talk about evaluations in the school. I know evaluations are the foundation for programming for the IEP, right? I mean, you can't really have a successful, thorough, specific, that can confer a benefit on a child unless you have really good data, really good assessments, really good information by which you can program. So in your experience, what's happened with assessments since the school closures from the school's perspective? Are you hearing that they're still assessing or not assessing? What have you heard?
Yeah, that's a good question. I think that I meet people every day who have safety as the highest level of concern. The highest priority is saving lives, keeping people safe, and that's what happened in the spring of last year. That was the focus: is let's wait, let's let this thing come out, let's see what happens. Maybe some good will happen. People, have waited, and I think I saw a shift in the fall, middle of fall last semester, where this looks like it's going to happen through the holiday season and into spring. So now what do we do with that? And there was this huge evolution of money coming into schools, buying this equipment to allow people to be across from a student. But this is what I'll tell you, schools have to do evaluations. That's part of the law. And if they have to follow special ed law, they have to do evaluations. COVID is not going anywhere. Viruses don't just disappear. It's going to be around and for years, and people are going to have to get vaccines every year. So what does that mean? In April, a month after shutdown, I looked at my staff and said, you guys ready? We're going to test kids. We're going to do this. Once the city and the county us to safely reopen, we've been testing kids since June 2020 in office and remotely, but it can be done and kids deserve it. If you went to the doctor right now with your child, you can take some medicine because the doctor thinks, well, maybe try this. We're not sure, but let's just try this. That's not what I'd be wanting to hear from my child. When my kids go to the doctor, when I go to the doctor, sometimes it takes time, but I want to find out what we're treating here, what's causing the problem. And that's why I am so passionate about this diagnostic process here. It's, to me, one of the most meaningful parts of this whole special education. In the beginning, in the late 70s, they just put kids in special ed, and they thought, well, we don't have to send them home anymore. Now we have to do something with them, so let's just put them in this classroom. And that's 40-something years ago. Today, we've come, I think, a long way in really trying to bring in neuroscience and learning together to really connect those dots so that out of this evaluation can come very explicit prescriptions. Just knowing that a kid has disability, just knowing that a kid has dyslexia is not enough to know what type of reading intervention the kid needs, because there are multiple types of dyslexia. And most people don't know that. My kid has dyslexia. Well, what does that mean? What type of dyslexia? Because I've seen kids be treated for the wrong type of dyslexia, and everybody wonders why they're not making any progress or bored or kicking things. So this evaluation is important. When organizations have had logistical problems, like I've seen since last year, they contract out to have people that that trust and that are reliable and that are cost effective come in and provide these evaluations. So there's always ways to get these evaluations, in my opinion. With proper PPE, the evaluations can have great meaning and continue to document the presence of disabilities, educational progress, and then educational need. So this is, to me, very important.
So what if a parent, comes to you and says, I really believe my son or daughter needs to be evaluated. I think they may have a disability. Or let's say a parent comes to you and says, my child is already on an IEP, but there's problems that are happening that weren't existing a year or two ago, and I think we need some more information to help my child. But the school is saying we can't assess now. We're going to have to wait. So what is your response to those questions from the parent?
Yeah, that's a really good question. Not every kid needs to go through an evaluation right now. That's for sure. I mean, safety, risk factors for COVID, family members in the home, all of these things take a very important place in this question, in this answer. I think that if I have 3 kids, 2 teenagers, high schoolers that have been sitting at home since March 13th last year, and a 6th grader that's in school, I'm watching them as a parent. I'm watching their emotional health, their mental health, their behavior, changing. I'm watching their learning. And when I suspect that they're not learning, I want to ask questions about that. So as parents, I think our job is, whether a kid has disability or not, is how is this working? How does this look? I think you have to know what, your child is, how your child is right now. And that's a big part of this question. I think that, going through this process takes work from everybody. Parents bringing their kids and doing the testing, and school districts doing it. But I don't think we should just, halt on doing all this testing. We want to document kids' reading, writing, and math skills. I just got off a meeting just now, and they're doing a test for reading on a computer, and the people in the room in the meeting don't know if it's accurate. They're not really sure because they couldn't see if the kid was actually on the computer. He's a 7th grader and he has 2nd grade reading skills. So, I see the value of, hey, let's bring this kid in and put an adult across from him and look and watch him read and get that information. That's real valuable for this kid. He's going to be in high school in a couple of years, and we don't want to miss something. I've also seen kids that are just doing fine, learning, they're passing classes, And, why do a 3-year if you don't need to? You can postpone it. You can work with the district and delay something. I do think that, I do think the districts have a lot of backup right now. They're still playing catch up from last spring and through the summer. It's taking time, but those are some of the concerns that come to me and that I'm interested to think about when parents call me. I don't tell everybody to go get testing. It's every kid's unique, and every kid is. But if you're a kid that hasn't been diagnosed yet, and you suspect that you're first or second grader, we need to get some information, because yes, it could be a part of this COVID shift, or it could be more innate, more biologically based, like a learning disability. And missing that window from first to second grade, now kids in third grade, and you haven't done any intervention, that's a problem for the brain's ability to learn and grow and be plastic, as it's known.
So if a parent were to ask you, should my child be tested? I mean, is there sort of a dividing point where, in one situation you might say, well, we can wait, it's okay if the district takes a little more time, they're backed up, versus a situation where, like, boy, we really should move forward. We need this information and we need it now.
Yeah, that's a good question. Yeah, so just knowing what a kindergartner is supposed to do cognitively, developmentally, the precursors for reading, the precursors for math and writing, the motor skills. I ask questions like that depending on how old the kid is. And when we're behind, and I think it could be COVID or maybe not, it's still a time to test. It's still a time to have that information. It's hard when you're in third grade and you're not reading. In fact, when a second grader is asked, "Are you smart?" poor spellers say no, and really good spellers say yes. So by the time a kid is in second grade, the perception is, if I'm not good at spelling, I must be dumb. That's in the research. So that's powerful. That's what shapes a kid's belief about him or herself. So by waiting, addressing this, you're also causing secondary, self-reliance, psychosocial issues that may not need to have happened. So to me, erring on the caution side of, let's bring this kid in and get phonological skills, orthographical skills, memory, things like that, I think are important. I'm biased. I do this for a living, but I'm also cautious as well. I don't put kids through stuff that they don't need. This can be sort of challenging, getting kids to do all this testing sometimes. We have to be very careful. But knowledge is power in this game, especially. It always has been.
Sure.
Knowledge is power. Mm-hmm.
Yeah, and as you mentioned, I mean, there really are no waivers for assessments, under the law during COVID. The triannual, or if the parent requests an evaluation for special education, districts may be backed up, but there's really no waiver under the law. I mean, the timelines still apply. So what, one of the questions I had is that, if a parent were to say, I'm just a little bit concerned about COVID and getting an assessment done, the health risks, what would you tell a parent?
Yeah, good question. So I know we'll hopefully talk about the remote test, but there's a lot of different options. There's different ways of doing this. Defining what testing means is the question. What is an assessment? We have Brain Learning has stepped up in September and contracted with local districts here in the East County, South Bay, and come in and help support their teams and provide assessments. The districts are big entities, and there are a lot of logistical hurdles that needed to happen. I told my staff, let's do this because benefits outweigh the risks when the kid can participate. So remote testing and in-person testing, even with PPE material and plexiglass and all of these things, kids are resilient as heck. Kids are so resilient. It's the adults who are, freaking out, going, whoa, this isn't normal. This is wrong. And the kids, what I found from June, from the beginning of June, they come in with their masks on. I hated wearing my mask, as a person, and the kids, I find, they just move along with it. As assessors, there are things to be very cautious about. But with the proper PPE equipment, knowing some of the risk factors, interviewing the parents, we then make decisions. Do we do this remotely, or do we have the kid come in? I think the experiences have been very meaningful, almost 150, maybe even more since June 2020 in here. We've been very blessed, we've been safe. We're all vaccinated here now, and we're, going through that whole process, but we've been very careful. And I think one of the things I'll tell your listeners, my training as a professor and what I teach my grad students last night is always caution. Even in the best circumstances, we still are trained to be very cautious with language, with culture, with disability, with all kinds of things. The face mask now, it's just another layer of caution that we have to be aware of. When a kid misses something, the first thing I want to make sure is why that kid missed that question. Did not hear me? Do I stick my head around? We manipulate something. And so those are kind of shifts in our clinical practice that we've had to do. And then certainly when we get this data, we're at previous data, we're looking around this kid and making sure that this is accurate. And when it's not, we're using all kinds of in our reports to make sure that that label doesn't follow a kid that's not correct. And so I definitely believe that this is the new norm for a while. There's still kids that haven't left their house since COVID, and they deserve what special ed is offering, which is an opportunity to make sure that we're reaching that kid based on a potential disability.
Sure. I was going to ask you this question. I think you already answered it, but what if a parent, ask you, well, should I just wait until this is all over?
Yeah. I would say, well, when do you think it's going to be over? How many? We're almost 300 days, since this whole thing happened, and when is it going to be over? You start doing you start counting minutes. If a kid's at school 5 hours a day, you start doing math, 180 days. You start really seeing and quantifying. Wow, there's a lot that's been missing here, and so what do we do with that? And kids without disabilities are going to recover quicker. They're going to, once they're back in school, and some kids without disabilities are learning, in this model, in this 2-day-a-week in school, remotely through the computer, they're able to learn. Some kids can just learn a lot easier than other kids. But once, they're able to get back into school, you're going to see a harder recovery. It's going to be a lot longer. Because that nature of learning disability, the nature of a disability, you don't really cure them. You don't cure dyslexia, you don't cure autism or ADHD, but what you do provide is kids with tools to getting around that. And that's what's hard to do right now through this modality of learning.
Right. I'm just curious if you've been able to track any regression. I mean, you've been doing this for many, many years, and you see how the general population of kids with special needs has either changed or remained constant over time. Are you seeing anything unique in the assessments that you've done, for example, more recently, since it's been almost a year, since school shut down? Are you seeing any trends in your assessment data about the effect of school closures?
Yeah, that's another great question. I don't know if I completely have the answer to it, because it's what we're dealing with every single day right now. And, we're all moving through this. We're not stagnant. It didn't just happen and now we can try to figure this. We're still in it. And if a kid's reading should be at 100, let's say we use the number of 100. His reading, he's in the 4th grade, he should be at 100 of some test. What I'm seeing, and what my question is that going to shift to maybe now 95 or 90 being the normal? We call it in here a COVID shift in the bell curve. And it's not anything I can say is scientific, it's just observing kids. When I go to meetings every day, I'm looking at these numbers, and now I'm thinking to myself, with 200 hours of missed opportunity, what's the consequence of that? Is my kid actually normal? I don't know really the answer here, but I think once we start testing kids on a larger level, like the Common Core test, the CAST, we might be able to see that shift and be able to quantify it and then understand it a little bit better. But right now, there's nothing for me to compare a kid with, even a classroom. I'm not even getting whole class data for kids right now. So it does make it different. However, we have to remember that even when a kid has reading, writing, or math skills below average, in order to make that diagnosis of a learning disability, we have to find a processing deficit. Basically, what we're doing is looking at the brain and saying this area of cognition is not performing as well as we would expect for the kid. And that's not a COVID-related situation. That's a biological related situation. So there's still that connection where I believe it helps us maintain our level of accuracy and validity, even so. Mm-hmm.
So tell us, what is the difference between in-person testing and remote testing? I know your organization does both, right? So how would you describe the difference?
Yeah, Thomas, in a million years, I never thought I would be doing remote testing. I've taught graduate school for almost 20 years and helped a lot of school psychologists what they're doing today. And I never would have ever advocated for, why don't we just stop doing it? We can do it quicker. It's cheaper. Let's do it remotely. That would never be on my mind. But I sat in my home, literally watching the grass grow in April of last year, and I had a lot of time to think.
Like a lot of us.
What's that?
I said like a lot of us.
I met a lot of neighbors I'd never even met before, walking their dogs, and it was an interesting time, but I had a lot of time to ponder. And I came to believe, like, I'm going to make this shift. I'm going to, because if I don't, what are the consequences? And if I make that shift, the first month I had 2 phone calls of clients calling, high stakes situations, Polinsky Center and one in the South Bay, and they needed information, and that's what I provide is information. And I had to make a decision, and I started reading. And so this remote testing is different in-person testing. And I'll tell you that I use Zoom, right? We use Zoom. There's a lot of different platforms. We went out and bought the best camera, the highest definition camera with the best mic and all of the DocuCam. And I started reading what the APA was saying, what the national organizations were saying, and the California organizations. I even read what the publishers of these tests were saying. And my general takeaway was some were more cautious than others. Some organizations out said, like California Association of School Psychologists, we're not recommending you do this at all. I don't know if they've pivoted since then. I believe they had in August, but other organizations were saying, if you're going to do it, this is what you need to do. This is how you have to do it. And I read through those, and we changed everything in this office, and we pivoted to be able to access kids. I believe those first 2 assessments I had were extremely successful, but it takes a lot of forethought. It's not just like come in my office and I can control all these variables. You're working with a kid and a dog walks behind her and barking, and then you lose her. Like all these little logistical things that make testing longer. It takes more time, and some kids, can't do this. And the last thing I'll say about this, what we're trying to do in this testing environment is this term validity. We're trying to make sure this is valid. If I put a label on a kid's forehead now for the rest of his life, is that a valid label? Is that a true label? Is that a true way to define this kid's learning needs? Is the numbers I'm getting, are they valid numbers? And to me, that's what it boils down to, is increasing our degree of caution and increasing our mechanisms of making sure that we've brought all that information in. And then what you get out of it is something helpful. I've assessed kids in Utah, all over Orange County, all over San Diego County, and I've never met these kids. And I never thought I could do that. I never wanted to do that. It's not my human nature, actually. I'm very experiential and interactive. But if I didn't do this, who else is going to do it? That's kind of my message to myself. You have to do this, because what if nobody else can do this right now? What's the consequence of that? And that's the gamble I was willing to take. And I think to this day, I harm kids. And that's the most important thing that we do, is not harm kids. So I think we're still evolving. The publishers are, I think they're doing a lot of research on new meaningful tests that can be normed and practiced the internet to make them more valid. So I think that's going to happen.
Sure. What about testing in a child wearing a mask? Is there any impact on, you mentioned the validity of a test and how important that is. Is the mask have any relationship to validity of testing?
Oh, yeah. Yeah, it's not something you can ever just ignore. Let me say it that way. We have to look at, even I've seen a kid come in where his mask was, I think, the wrong size. He couldn't stop trying to pull it over his head. Well, that's a competing variable there for me getting his attention.
Sure.
So what do you do about that? Well, we go down the hall where we have all of our masks and we get him a mask that fits. And then there's let's say a kid with autism. You know, our human nature is wired, our brain is wired to watch people's mouths and interpret what we hear and make sure it has meaning. A lot of facial expressions are masked a little bit by this material. So when it comes to, say, a kid with autism, we have to use a lot of caution and change the way that we used to look at gathering information for that diagnosis. There's a lot of visual testing that we do on the iPad, and that's been easier to do. So anytime I give a test that's auditory, I'm checking to make sure that kid can hear me. You know, I'm really controlling for a lot more things than I ever would have controlled for. And once I feel like, okay, this kid understands this test, and then he can hear me, you know, we move forward. And there's times in these reports where I'll say, you know what, I didn't follow the rules of the test, and I have to report that to the reader and the people in the, know that this data, I believe, data is gathered in a different way slightly than it would normally have been in. And so this is what this means as far as school goes, as far as the classroom goes. But there's, some kids are nervous in the beginning. They were a little bit nervous, some kids, and, we've evolved. When a child sees an adult nervous, guess what the child feels? Nervous. Sure. The child feels the adult's happy, fish tanks and toys and all the other stuff. We spend a lot of time cleaning. We added a lot of time on the back end of soaking toys and putting things in and cleaning. So all those logistical things that we're all experiencing are necessary.
Sure. I just had one other question about masks. I mean, taking a child with autism, have you found maybe some of your clients have sensory issues that make it difficult for them even to wear a mask?
That's right. I can't say that we have 100% compliancy rate when it comes to masks in this office. I'll put that out there. I'm supposed to follow strict guidelines, and we do the best we can. But some kids can't hold that on, and they do their best. So we do our best to try to work with the kids and make sure that we're getting good information about them. There's a lot of other things too. I'll in this day and age, it's easier for me to grab a hold of a video of a kid and outside this office. Some kids have behaviorists coming in their home, and we can video in on that. This Zoom is a game changer. Zoom allows me to reach clients I never would have been able to reach. It allows me to come into situations that were previously very difficult for me to come into. So I take and use any of that information. Videos, we're always asking parents, can you take a video of that? In your home without the mask on, out in the community without the mask on, or in the home with the behaviorist with the mask on. That's been very helpful, and it's helping put the pieces together that are not able to be completely put together in this clinical setting here in the office.
And I think that keeping track of progress and data is really important for parents. You mentioned videotaping and so on and so forth. Do you have any tips for parents on how they can measure progress, track progress, keep data that, maybe ultimately could be shared with your office so you have more information to do your evaluations?
Yeah, that's a great question. So work samples are very helpful. It's sometimes just asking, if we're talking about a learning disability, just ask your child to just ask your child to write a letter, or write a poem, write something. That's it. That's a work. If your child's in first grade, second grade, third grade, go on the internet and print out a first grade, worksheet for math. I think we can't rely right now on teachers being able to gather that information. That's been my experience. When I ask the educators, we're not sure. He gets on the computer and I think this is what he's doing, and he may not be turning it in. So for young kids, it's easier. Now you have a high schooler, you want to get a math work sample, good luck. I don't remember a lot of geometry and pre-calculus and all that stuff, but younger kids where we're really focused on trying to understand if there's a learning disability, you can get these work samples and you can videotape this. You can videotape your kid doing all sorts of things, and then you can share that with the examiner, and that helps you cover those gaps that we have in this setting. So tracking your child's important, and you can do this in different ways. Even if it's watching your child on a video screen, you can sit and take a 10-minute sample of every 30 seconds. Is he looking at the screen? Is he not? Is he looking at the screen? Is he not? And after that, you get 10 minutes and you have some numbers where you can say, this kid was off topic here. He wasn't even accessing this for a certain percentage. And some of that, may sound kind of complicated, but you can also just document it by taking notes, just by writing things down in a journal. And then how your child's feeling at home. When you sit them in front of a book to read, kids shouldn't be screaming to read. I mean, it shouldn't be painful. That's what happens in dyslexia. Kids can read. A lot of kids with dyslexia can read, but the amount of mental effort that they have to employ to do something that a third grader can do automatically by third grade is significant. And that's noteworthy. And that's where we come in and say, yeah, it's dyslexia. And people will say, but he can read. But he's not reading fluency and automatically. And that by third grade, he should be doing that already. So I think those data points are important. Social behavior, you can videotape that. Even setting up a situation where you're just talking to your kid, I can take a look at that interaction, a dialogue, and make a lot of hypotheses about that later I can test when a kid comes into the office.
And I think that data is really important for the IEP team as well. Because obviously with distance learning, it's difficult for teachers to see, quote, behind the scenes, like you talked about screen time or attention, things of that nature. How are they going to be able to measure that, when they're teaching in a distance learning model? But if the parent can bring that information to the team at an IEP meeting and say, hey, here's what's working, here's what's not working, the parent can play a really important role in, kind of filling the gap of what's happening at the other end of the screen, so to speak.
That's right. The tables have turned. It used to be us parents coming in for teacher conferences and going, whoa, I didn't know my kid could do that, or I didn't know my kid wasn't doing that. And everything happened in this brick and mortar place. And today I'm in meetings all day, and the people in the school don't know anything about the kid. And, I'm not blaming it. That's the way it is. So where's the information coming from? Besides me, the person that did an evaluation, is absolutely from parents. They've become the best, reporters and perspective for what's going on in the home. They've become essentially, these teachers in some ways. And that's different. That's very different. So we all need to listen to parents, just like we always have, should have been. But now we really need to listen to them, because we need to change how we make decisions for kids and what information we're using. And if we can't get that ourselves, we need to set up situations. I think schools need to develop ways, best practices, if you will, of parents track parents. What may be obvious to me, 25 years with a kid, may not be obvious to a young parent with a young kid. So it's not the parent's fault. It's not something we're used to doing, because we send our kids out and somebody else does that. So it's really changed right now. And if we work together, I don't see every kid going back to school next year. I don't see every kid being able to do this for a number of reasons. So we have to develop these kinds of systems and best practices, I think, to really make sure that we're doing the bst we can.
Yeah, I mean, as a special education attorney, I've always told parents, what an important part of the IEP team they are, and how significant that role is. But I think, as you mentioned, it's more significant now than it ever was. They have so much information, at least, if they're keeping track, they're watching, they're videotaping, they're taking notes. Yeah, they play a really important role today more than ever, probably.
Yeah.
Great. Well, thank you for this. Has been great information, just wonderful. I'd like to finish the webinar with, on a positive note, just a story. If you could tell us a child that you've worked with and you've seen, where they were before they came into or when they first came into your office to where they are today, and saw that change, that your assessments, your evaluations have helped generate a new path for them.
Yeah, no problem. Before I say that, Thomas, in 1975, when President Ford then was getting on a plane to China, his advisors grabbed him, as you probably well know, and said, "Wait a minute, you better sign this bill here." And he said reluctantly, "I will sign this, but I'm not sure how we're going to pay for it." And his advisors would have said, "You see all those parents and those advocacy groups, they're not going away. You have to sign this." And what does that mean today to me? When I learned that, empowered parents are the best way to spend energy. Empowering parents, providing knowledge to parents is the best way to spend my energy, because in the end, as a parent, you're always going to be there for your kid, and the more knowledge you have about your child's disability and your child in general, is you're going to be there. So I'm all about empowering families, and it's important. In terms of the question you just asked, this is what I believe, and I may not completely do this right in terms of a specific kid, but I'm afraid sometimes I'll go too deep into a specific kid and let out too much information. But let me tell you what we do. I started this business with a mission of providing the best assessments. And then as I evolved in here, I decided and determined that it's not the best assessments. That's the vehicle for what our mission is. I believe that when done right, I have the power to change kids' lives. And that's a big deal. Educators do that every day. I'm not saying I'm any better than anybody else, but what we're doing in this evaluation is changing kids' lives. Literally, we're changing trajectories. That kid that's a second grader that thinks he or she's dumb, when they leave out of here, they don't think that anymore. So kids come into this office, I would say, broken, and not necessarily physically, but emotionally broken. Special ed is not a perfect place. It still doesn't have all the answers to what we need it to have. When you're not in a general ed class, you're missing something. And how do you ever get that back? You don't. You missed it. And you missed it because you needed something more important for you based on your disability. Having kids come in here and learn that they're not dumb, and that and really understanding what this whole thing is, and this reading disability is the most magically powerful thing that I have ever done. And that's what drives us in here. We're a very small group, about 13, and we want to see kids all over. I go to Imperial County, Monterey, Orange County, all over LA. I mean, I go all over the state where the kids are. And I think that I have the power with my tools and my practice to take kids that thought they were dumb and change that attitude. And I can help other people do it as well. And that's like the summary of, I could go much more into a lot of specifics, but I see this every day. I've got this down really well now. I know what it's like now. Everything else we do is welfare to work testing here all over the state in the program called CalWorks. I never would have thought that a 26-year-old would come into my office and think she's dumb and not know, even though she had an IEP in K-12, not understand what her disability was. That was the biggest aha moment of my career. And I thought, what? Adults? Nobody. And so today, we've pivoted a little bit to making sure that we do not pass a kid up, and make sure that kid and the family and the community that knows that kid got their eye on the right prize, and that is in empowering that person with knowledge about who he or she is. It's so valuable. So thank you very much for having me.
That's fantastic. I completely echo that. As a special education lawyer, I feel I have a small part in that as well. And I helped a young man and his sister when they were in, I guess, 7th and 8th grade. And years later, their mom came in with them as adults, and they were both in college, one at Purdue and one at University of California, I think it was Merced. And they came in to thank me. It changes the direction, the trajectory of their lives. And that's, I mean, how can you have a more rewarding role than that?
Yeah, I'm very blessed, very blessed.
That's great. Well, Renzi, tell us how parents can get a hold of you and your organization if they, have questions or want more information.
Yeah, I think the easiest way is just brainlearning.com, BRAIN learning.com. That's our website. And I think there's a lot of good information there that you can read about, or you can call. You're always welcome to call my office and ask for me. And we will be accessible. That's the way that we are successful in here, is we remove barriers. And barriers play a lot right now, especially of kids getting what they need. So go ahead and call if you have any questions. I speak to parents all day that really don't need what we're doing, but I'm, as a community member, I'm trying to guide them in the right direction and help them understand what they can ask for from the school and what the school's approach should be. So I believe in providing and helping with knowledge, and I'm very passionate about that. And I love giving away my time. My office doesn't always appreciate that, but I like that I can feel like I'm a part of this community. Thank you.
Well, we really thank you for giving your time here today, because this is a lot of helpful information. It's a tough time out there for parents. And I think, information is powerful. And if we can help guide them through this rocky time and get the best for their children, this is what's most important. And I really thank you for your time, Dr. Heidesing. You've given a lot of great information.
Thank
so
you.
With that, I'm Thomas Nelson, and log into www.myspecialneedsconnection for more information and more free webinars. And thank you again for joining us, Dr. Heidesing.
You're welcome. Be well. Thank you.
Have a great day.
Yeah.